What you also learn is that human beings are much, much stronger than you ever give them credit for in a crisis, as long as you're not alone, as long as you have somebody to share with. And there is not one single dying patient that does not know they're dying. If you go and visit somebody who is terminally ill, what is your biggest fear, or what makes you leery to talk about dying? Yeah. What you think that you depress them or upset them? What do you do then in order to avoid it? What are you talking about? You talk about the weather and the nice flowers and all the baloney. And you understand when it comes to dying, you couldn't care less whether it's 50 degrees or 55 degrees, because there are a lot of important things. Your values suddenly change. And you know who comes into the room and is a phony baloney and talks about nice things and just comes because one ought to. And who comes and really shares of themselves. The easiest thing in the world is to walk into a terminally ill patient's room and say, I would like to help you. I don't have the slightest idea what I can do or what to say, and I'm in fact very leery about it. But maybe we can help each other. And they open up. It's like opening floodgates. Or you touch them and say, God, it must be tough. And they say, tough, that's not even a word for it. I've rang the nurses about 6 times, nobody comes. Everybody has rounds outside. All my relatives are coming visit me with all these fancy gifts, and before they were so stingy, they didn't even give me a Christmas present. Don't you know that I know? And, you know, they begin to share what it's like when somebody suddenly becomes, quote, a dying patient, and they can get away with anything and everything. When you work with dying children, that's even worse. They get an electric train when they're 3 years old. You know, they get anything and everything. And why do people do that? Yeah. And out of guilt, you can buy them something. You can never buy love. It is, patients know that instantly. And they write you off, or they just keep quiet, or they're at the end grateful when nobody comes anymore, because it's all phony baloney. Every dying patient, and then after many years I started working with dying children. Now I work exclusively with dying children, almost exclusively. I work with parents of murdered children. Next week I go to Atlanta to see, you know, all the parents of those children there that I presume you're familiar with, or parents whose children commit suicide. And they have a much harder time, because parents whose child commits suicide, you understand, is terribly heartbreaking. And the guilt and the shame and the concern they have is just absolutely devastating to them. And they tell you why children commit suicide. And if you belong into that group, think about it before you act. A few weeks ago I was in New York, and I was in a very conservative group of very nicely dressed, formal people. And I knew I had to be very conservative with these people. Do you know what the proper lady looks like? You know, with the hat and the gloves and the handbag and the shoes fit all proper. But they're very different from me. And this lady just stared at me during the whole lecture. And at the end, I knew that she wanted to talk to me, but she couldn't quite make it. And I gave her ample time to do it, and she left in a hurry. And this was about 11 o'clock at night, and at 6 o'clock in the morning she came to the motel. And that's very unladylike to come visit me at 6 in the morning, because I'm not awake till 10 a.m. But I had to catch a 7 o'clock flight, and she came and she said, I have to tell you what happened to me last night. This was her language, very unladylike, but very authentic and genuine, which is much more real than all that nice front. She said, last night I came home and my 18-year-old son was sitting on the refrigerator again with his friends. And the way she said friends, you could smell it, you know, with contempt, with disgust almost. Said he sat on the refrigerator again with his filthy, icky, worn-out, washed-out T-shirt. And I can tell you that the last few months, every night we bitched at each other for hours, and that's how he went to bed, every night. Last night I came home, and he sat there again with his friends in this washed-out T-shirt that he got from one of his girlfriends. And I took one look at him, and I said, Bob, if you want to wear that T-shirt, it's okay with me. Because if tonight you drive your friends home and you would be in an accident and you would get killed, I would bury you in this T-shirt. Do you understand the beauty of this confession? And that's all she wanted to share with me. That is the gift of my work. Do you understand that? They suddenly change their values. Why is it important to waste so much energy and so much ugliness and so much negativity on a mother and child relationship? Because of a stupid T-shirt. And her only fear was, what are the neighbors thinking that we cannot afford to dress you right? Do you understand the peculiar values? I hope that you remember that. That's the kind of things that we did to our children that were done to us, and so we pass it on.